Oh, Francis, tell me about reflexology.
Reflexology is the application of the appropriate pressure to specific points and areas on the feet, hands, or ears. It is believed to have beneficial effects on the organs and on general health. Reflexology has its origins traced back to ancient Egypt and China and is thought to have spread via the Roman Empire. The zone theory was the precursor to modern reflexology. Known as zone analgesia, in this practice, they applied pressure to various zones that then corresponded to various problem areas. This practice used a chart that listed longitudinal zones of the body and utilized various tools such as elastic bands and retractors to apply pressure. The zone theory was then further added onto by Dr. Fitzgerald and Dr. Riley, who added horizontal zones to the hands and feet. Physical therapist Eunice Ingham in 1930 then developed the foot reflex theory. She believed that reflexes on the foot exactly mirror organs, glands, and parts of the body. She made a reflexology chart that is now currently utilized in modern reflexology practice.
Although the cost of reflexology differs from place to place, approximately costs $30 for a 30-minute session and $55 for a 60-minute session. You can find reflexology therapy in different clinics and massage parlors. Some benefits of reflexology include pain reduction, for example, those with chest pain, peripheral neuropathies, diabetes, kidney stones, and osteoarthritis. It can also help with relaxation, it can lower anxiety, and also has been shown slightly to lower blood pressure. It can also decrease symptoms in those with kidney problems, and it can have a positive impact on specific organs, primarily the kidneys and intestines. Reflexologists claim that reflexology can also treat a wide variety of medical conditions such as asthma, diabetes, and cancer, but the scientific evidence is lacking.
Reflexology is known to show potential benefits in a variety of health conditions, however, no evidence-based review was yet done in testing the treatment's efficacy. In 2008, a systematic review was done by the Journal of Advanced Nursing to evaluate the efficacy of reflexology in any condition. 5 controlled clinical trial studies were reviewed, and they reported in outcomes such as symptom relief, quality of life, and patient perspective of the CAM. Among the 5 reviews, there was only 1 report of a statistically significant treatment effect. Among the 12 outcome variables examined, the effect size in all conditions were negligible, except for the urinary symptoms where the effect size was large. In conclusion, there is no evidence for any specific effect of reflexology, with the exception of the urinary symptoms associated with multiple sclerosis. Routine provisions of reflexology is therefore not recommended.
Now we're going to demonstrate for you how a typical reflexology session would look like. I'm first going to start with a demonstration of reflexology on the big toe, which correlates to the brain. Another example would be for the kidneys, which is located near the middle of the foot here. As you see, I just apply pressure there. And that can be done throughout areas of the foot that correlate to all the different parts of the body. And so the reflexologist will determine which specific parts to touch depending on the reason for your visit.